There isn't a day that goes by that the president doesn't focus on this unemployment rate, and he thinks today is a great opportunity to bring in new, fresh ideas.
That will be the message for the entire next year from the Obama administration. Obama senior advisor Valerie Jarrett this morning.
And a particular message today, you get the sense there may be new jobs numbers coming at some point with this new focus. Top Line starts right now.
Hello and welcome to ABCNews.com's Top Line. I'm David Chalian.
And I'm Rick Klein.
Each weekday we're bringing you the very latest political headlines, reporting, insight, analysis, everything you need and want to know about politics.
And join us via Twitter at twitter.com/thenote to let us know what you think.
Remember, this week was Afghanistan. No more.
Not anymore. It is now jobs versus jobs. Dueling job summits, one at the White House, one hosted by House Republicans today. Tell you that is the #1 issue on the political agenda. President Obama trying to change the focus to jobs and to the economy. And one must get the sense, David, that if the president wants to have that debate, Republicans are willing to join him on that field as long as unemployment is above double digits, particularly.
There's no doubt about that. Valerie Jarrett says fresh ideas. There's no fresh idea here that matters. All that's going to matter is if Americans are getting employed again. And if they are, then the Republicans are not going to be so happy to talk about this. They're going to want to find another issue. Hostess on the hot seat, Desiree Rogers, the White House social secretary, was the subject of tons of questions at the White House briefing yesterday. This cannot please White House Press Secretary Robert Gibbs that we are a week into this story, and he is taking questions from the podium about the social secretary, who now actually may be subpoenaed because they were invoking executive privilege instead of having her go up to Congress and talk about what happened with the Salahis and this gate crashing event.
A constitutional crisis after the gate crashing because they're saying that she shouldn't be testifying. And of course, the Salahis, this time they were definitely invited, and they're saying no to the House Homeland Security Committee. Next up, we have the slow walk. We promised that today we finally have health care votes. We've been talking about it for days, but we mean it this time. Real votes on health care. And think about it, David. It's taken them 3 full days of debate just to agree on how and when they're going to start voting on the scores of amendments that we have. And out today is Senator Judd Gregg. He's got something of a user's manual for the filibuster, all the procedural tactics that Republicans can use to stretch this out as long as possible.
He'll have plenty of time to use it now that they're going to be working weekends and perhaps on Christmas, according to Harry Reid and Mitch McConnell. Contract renewal, Ben Bernanke up on the Hill for his confirmation hearing for a second term as the chairman of the Federal Reserve. Obviously a controversial figure, really gets the ire up from the left because of the bank bailouts and what have you, though I think a lot of people, and perhaps Time Magazine's Person of the Year, we'll see how that comes out, included that this is the guy that saved the economy from the brink. Bernie Sanders, the independent from Vermont, putting a hold on this, though not really going to be a hold. It looks like it's going to move forward.
Yeah, I think that's right. It could be a lot like the Afghanistan surge, where you get bipartisan support where you may not necessarily want it. It's symptomatic, though. It's going to be another avenue for Democrats in particular to express some displeasure with the way that the economy's been handled. We're
going to begin with the economy and the health care debate up on Capitol Hill. We're joined by Democratic Senator Ron Wyden, Democrat of Oregon. Sir, thank you very much for being with us. I want to begin with health care, if I can. Obviously, first vote's getting underway, and this health care bill will move back to center stage. Now, one thing that has been reported in the last couple days is that your colleague Tom Carper of Delaware is in charge of brokering a compromise here to get 60 votes on some kind of public option. Do you know what he's working on and what that public option may be that might get 60 votes?
There are a host of senators that are working on this issue, senators from all parts of the philosophical spectrum. The bottom line is you need choices, public choices and private choices, to hold the insurance companies accountable. It's choice and competition that for the long term is going to hold premiums down. I have long felt that the ultimate goal here is for each consumer in this country to, in effect, be able to give an ultimatum to their insurance company. That ultimatum ought to be treat me right or I am taking my business elsewhere. I think the senators that are trying to bring our caucus together, reach out to Republicans, that's been my objective, are on to some good ideas.
Of course, there is a public option in the current bill, in Senator Reid's bill. The presumption is that what Senator Carper is going to work on is going to scale back some parts of it and maybe make it an opt-in instead of an opt-out. Would you be comfortable with scaling back how robust this public option is?
I'm open to a variety of iterations with respect to how to do this. I do think that the end game is holding insurance companies accountable. My concern is you can't let the public option be something of a healthcare ghetto. Right now it looks like The folks that are going to be getting into it are people who haven't had insurance. The evidence shows that those are folks who didn't get checkups, didn't get prevention, didn't get chronic care maintenance. United Healthcare has more than 50 million subscribers, according to their website. They're not going to be quaking in their boots if you just have a healthcare ghetto. So the challenge now is to create sufficient private and public choices to hold the insurance companies accountable, get a better premium deal for the consumer.
Can you do that on a state-by-state basis instead of a national, federally government-funded program?
The challenge is to get the pools as big as you possibly can, because that holds down administrative costs and gives more clout to the consumer in the marketplace. Also, the Congressional Budget Office report that came in this week on premiums gives us some good news on that account. They said that we're making real progress with our approach in the Reid legislation to hold down administrative costs. And you have to remember the context of that Congressional Budget Office report on premiums. During the Clinton years, if you got a report from the Budget Office, it was practically a death sentence. In effect, you saw headlines, Clinton bill just wouldn't work. This Budget Office report on premiums shows that we've laid a real foundation, and it provides something of a roadmap to create more choices and more competition to hold premiums down.
Senator, a big Republican criticism coming out, particularly about the Medicare Advantage cuts. And I know this is something that you've been very cognizant of, and I think you've got a provision in the bill that would protect Oregon in particular from this. Do you think there needs to be broader protection, scaling back some of these cuts to protect seniors across the country?
Let's unpack this Medicare Advantage argument and do it carefully, because I think Senator Baucus has carved out a responsible approach. Not all Medicare Advantage is created equal. I've listened over the years to discussions about some Medicare Advantage products, and you got the feeling that the CEOs ought to be put in jail for some of the outrageous practices. Then we've got some very good Medicare Advantage that's playing a real role where you've had problems in getting access for seniors in the past. What Senator Baucus is trying to do is use an approach that promotes what's called competitive bidding, which is going to help us get more value for the healthcare dollar. He also tries to provide some extra help for programs that have done well on the quality measures used by the government. I think that's the responsible way to go.
Very quickly, in our last 45 seconds here, Senator, the president's Afghanistan speech the other night. Are you prepared to vote for more war funding to support this surge when the president asks for that?
I'm on the Intelligence Committee. I'm going to wait to get a classified briefing, but at this point I am skeptical about the idea that tens of thousands of additional troops and billions of dollars can help us achieve the president's stated goal and to have an enduring impact on reducing terrorism and the threat in that area.
Do you think there's any way to go from skeptical to supportive?
I'm going to listen to the evidence. Look, I'm constantly asked about whether my concern is that Afghanistan is going to be another Vietnam. I'm concerned Afghanistan is going to be another Afghanistan. There is centuries and centuries of conflict in that region. I think it is going to be very difficult to dictate a military solution.
Senator Ron Wyden, Democrat of Oregon, thank you very much for being here today. We appreciate your time.
Thank you for having me.